All right, I want to talk to you guys about removable cases in regards to opposing a zirconia full arch hybrid. You know, with the materials out there today with processed acrylic, traditional denture teeth, even with the digital dentures and some of the ceramic resin, it might have a 6 to 12 month, maybe 18-month lifespan, but we're seeing a lot more wear on those cases just because you have two different materials. So this is a zirconia arch, and then this actually is a digital denture. So the digital denture is a 3D printed Sprint Ray Apex base, but the teeth are actually milled in zirconia. So in the same puck, zirconia, we're milling a lower full arch hybrid, and then we're milling an upper, and we're bonding that in to a 3D printed denture base, and we're getting really good results. This one has some older implants that the doctor's utilizing with locators, so it's 2 upper implants for now. But the printed denture base, we do a 3D printed monolithic try-in, and then we do a 3D printed monolithic try-in for the opposing. And the patient wears those monolithic try-ins before we go to final zirconia. And so now we're getting ready to ship this out to, I believe it's a dentist in Michigan, possibly. So the lower has 5 implants, and then the upper, again, like I said, had 2 implants. So we'll look at that lower design here. We used a vortex screws on this, but it's nice to have 2 like materials. One of the other struggles for a technician is saying, hey, the patient wants B1, OM3. And then there's all these different materials out there in terms of zirconia brands and manufacturers. Their OM3 is going to look different than like what a Vita, you know, IPN, Vita Portrait, or classic denture tooth would be in regards to OM3 zirconia, and then trying to match a denture tooth to that can be a problem. And also it's different function and wear. Now that you have zirconia over zirconia, you know, we get a nice aesthetic look and no staining. Patients just have to be careful. You know, I did have one patient last year that dropped this on her porcelain countertop. Because it is a monolithic zirconia, she just barely fractured her upper incisal edge, and that was just polished off. But for the most part, we've had really good success with this, and it beats having to retread or reprint dentures every, 6 to 12 months.